just carrying on with that theme, I'm not going to talk for very long either, so I just want to give a bit of context. When Colin set the agenda, he put my introductory slot in and put finance against it, and I said, can we change it? I don't want it to be about finance today, but I can't miss the opportunity with so many people in the room just to give a bit of context as to where we're at as an organisation and broadly where the whole NHS is at. The whole of the public sector is still in a period of significant austerity. It means we are expected to do more for less financially, and we've been in that position for probably 4 or 5 years now, and I suspect we are going to be in that position for another 4 or 5 years to come. This organisation's got a reasonably good track record of delivering those financial efficiencies over the periods that we've been through. But what's become really noticeable in the past 12 months really is it's getting harder and harder to do that. And one of the reasons it's getting harder and harder to do it is because we've done all the easy things. We've done all the efficiencies through teams, through reshaping. And actually what I would describe as we've done a lot of the transactional savings. And what we need to now focus much more of our effort on is transformational savings. Which means looking at the way we do things and the way we support our infrastructure. So today is really important because a big part of that transformational change is what we do with technology, how we allow all our staff within the organisation to be equipped appropriately to deliver services in a different way. So David mentioned briefly the overarching trust strategy. I've got responsibility for a couple of other enabling strategies. So the board, in the next couple of weeks, will be receiving an estate strategy to make sure that the environment we deliver services from patients and our staff is fit for purpose into the future. But linked into that very closely is the informatics strategy, because actually how we deliver services and how we use technology has a big impact on the sort of estate and how our staff work. But we're getting the estate strategy in a couple of weeks' time, but the board received an informatics strategy probably 6 or 7 months ago. That was driven in part by the fact that the National Programme for IT, a lot of the big contracts are expiring, and we had to take action. We had to make sure that we had clinical systems in place for when those contracts expire, and therefore we set off on the journey of so what are we going to do? We've got broadly 4 clinical systems, but we've got two large systems of which we're going to hear more about today. But Lorenzo and System 1 are the systems we use more than any other. Broadly, Lorenzo for mental health and System 1 for community, but there are some differences within there. So we set off on this path saying these contracts are going to expire, what are we going to do? And the logical thing is we start to re-procure. And then that starts to drive you down the path of actually taking those systems out and putting a new one in. And we think, well, we haven't had these systems very long. They're not perfect, they don't do everything we need them to do, but actually, should we not be spending our time and effort on actually improving how those systems can deliver for us, and how can we work with those systems? So we took a slightly different direction, and what we've decided to do is that actually, with the core clinical systems, we want to try and stick with what we've got. Now we've got some procurement issues to work through to see whether that's possible or not. But if we stick with Lorenzo and System 1 predominantly, the feedback that we get fairly constantly from staff is the interface. I have to input multiple times. It's not very user-friendly. I don't understand how it works for me. It's very time-consuming. And that starts to drive significant inefficiencies in our systems. And that's just when you work within the trust. And many of you will work with partner agencies, be it the acute trust, be it social care or others. So when we start to look at how those systems need to work together, it starts to become very complicated, and a good number of staff start to have to do multiple data entry, which is not value-added time for the individual or for the organisation. So what we said we'd try and do is, and this is non-technical in my simple terms, if we stick with the core systems, what is it that we need to improve? And in very simple terms, what we need to improve is how do people get information into the system, and how do we get information out of the system? So the getting the information out of the system is not really something we're going to cover today, but we're working with a range of organisations to develop something called a data warehouse, which means that once all the clinical and other information is in the system, that the performance team, the information management team are able to do much more with it. And therefore they can work more efficiently on producing reports for the board, producing reports for teams and so on. So that's a whole piece of work that's going on that I say we're not really going to touch on today. But the really, really important bit is how do all of our staff get information into the system, and how do we give them tools that means that they've got an interface that they feel comfortable with, that works for them, that supports them in delivering care. So not all of our staff, but a good number of our staff are mobile, community-based staff. And what the nirvana, the vision is that everybody has a device that has the clinical information they need to see that patient wherever they need to be it real time or near to real time or whatever we think is appropriate. So the technology's there, and we're going to hear about some of that today. How we deploy it for different teams and how we make sure that we don't try and come up with a one-size-fits-all solution is what we want you to tell us and what we want to work through with you. So some of the things that you're going to see today are things that we've either already made a decision we're going to use, or we're in the process of developing our plans as to how we can deploy some of the technology that's available. So I'm not going to say much more than that, really. We need your feedback, and I think people will be reminded at various points in the day, we need you to tell us what you think. We have got a Q&A session at the end of the day. I was hoping to stay for the full day. I do need to dip out for a bit in the middle of the day, but I'm going to be around for quite a while. But I will be back for the end of the day, because I think it's important that we collectively do the question and answer session, and I know David's going to try and make it as well, so hopefully we'll be back for that. So that's all from me. Enjoy the day.